Each year, more African American women die from heart disease than breast cancer, lung cancer, and strokes combined, which makes heart disease the #1 killer of African American women in our nation. However, studies have also revealed that less than half of African American women are aware that heart disease is their #1 cause of death. African Americans have the highest hypertension rates in the world. And African American women are also the least physically active group of women in the United States. So now's the time that we focus on changing the narrative on heart health in African American women. Unfortunately, African American women are faced with an overwhelmingly high burden of negative social determinants of health. And these include chronic stress related to factors like food insecurity, systemic racism, the wealth gap, and socioeconomically disenfranchised communities. And many of these issues have unfortunately been amplified with the COVID-19 pandemic. And these challenges really prevent African American women from following a healthy lifestyle and controlling many of the heart disease risk factors. FAITH stands for Fostering African American Improvement in Total Health. And we aim to support African American women that are a part of Black churches in improving their heart health. And another way that we can address many of these disparities, as mentioned previously, is to increase diversity in clinical trials and also to develop policy level interventions to address many of those social determinants of health that I mentioned. I truly, truly recommend that African American women be diligent to protect their own hearts and also to take time for themselves. So self-care really does matter.